since 1991, and he's now coordinating the development of 3 new global health sector strategies, including strategies on HIV, viral hepatitis, and sexually transmitted infections, and he'll be speaking to us on developing a global action plan to improve access to hepatitis C treatment.
Thanks very much. The presentation I'm giving today is to really talk about the role of a global strategy in setting global targets to actually help move the whole agenda for improving access to hepatitis C treatment. What I'm going to be talking about is a global health sector strategy on viral hepatitis. It isn't specific to hepatitis C and it isn't specific to treatment, but clearly access to hepatitis C treatment has to be very much embedded in a global strategy. I'd like to dedicate my presentation today to Glenn Thomas, who was a member of the WHO delegation to the International AIDS Conference in Melbourne last year, and who tragically died in the Malaysian Airlines crash a year ago last Friday. In my presentation, I'm going to cover 4 areas. Firstly, I'm going to argue that hepatitis C is an international public health priority. Secondly, I'm going to talk about the political movement towards the elimination of viral hepatitis. Third, I'm going to provide an outline on the draft global health sector strategy on viral hepatitis. And finally, I'm going to talk about how that strategy actually speaks to various actions that need to take place to increase access to hepatitis C treatment. The strategy that I'm going to be talking about today is a draft strategy. It's available on the WHO website in detail, and it's currently under development, so there's still opportunities to provide input into the content of the strategy, and the strategy will be considered by the World Health Assembly in May next year. Now, clearly, in the presentations we've heard already, from the plenary presentation this morning, hepatitis C is an international public health priority. We've seen that there's an increasing burden of chronic hepatitis C infection, and the burden is comparable with other major communicable diseases such as HIV, TB, and malaria. But unlike some of the other communicable diseases such as HIV, malaria, and hepatitis B, the actual burden is increasing rather than decreasing. We know that there are highly effective interventions, both for prevention and treatment, including harm reduction programs, safe injection practices, and of course, most recently, curative treatment. And we also know that by acting on hepatitis C can have a huge impact on public health outcomes. We're talking about tens of millions of people who can be treated, and by being treated can live long and healthy lives. You've already seen this slide. Currently, under WHO guidelines, the eligibility of treatment for chronic hepatitis C infection is for about 26 to 30 million people, those people who have significant liver disease. However, overall, there are between 130 and 150 million people with chronic hepatitis. And from the presentations that we've heard earlier today, clearly we need to start thinking about reviewing that eligibility criteria. Do we need to move beyond those who have significant liver disease to cover an increasing number of people who are infected? And it's particularly relevant at this conference, given the whole discussions around earlier treatment for people living with HIV. And I'm sure that whether it be next year or in a few years' time, we will be having the same discussions about early treatment for hepatitis C. Now, apart from recognising that this is a public health crisis, we also need to recognise that there's a huge political movement towards a more effective hepatitis response. And in fact, that discussion now at a political level is talking about the elimination of hepatitis as a public health concern. The World Health Assembly in May last year, 194 countries called on WHO to look into the feasibility of eliminating hepatitis B and hepatitis C, and for us to consider establishing global targets towards the elimination of these two chronic infections. At this very moment, there are negotiations which are ongoing at the UN on the development of Sustainable Development Goals for the period 2016 to 2030, in which there is a call for ending the AIDS, TB and malaria epidemics, and also to combat hepatitis. This is the first time ever that hepatitis has been included in the International Development Agenda. The Sustainable Development Goals also call for universal health coverage, which means that all people should receive the health services they need without experiencing financial hardship. So this is going to include access to hepatitis C treatment. We are also seeing that there are very significant movements within countries and by civil society for action to take place. For example, in Egypt, the President has made a commitment to treat 1 million people with chronic hepatitis C. Now, given that there has been a call from the World Health Assembly for us to act, we are in the process, as I said, to develop a global health sector strategy for the period 2016 to 2021. We have convened already a broad set of stakeholders and experts to look at what might we consider to be global targets for the periods 2020 to 2030. What I'm presenting to you today is a set of draft targets which were presented for the first time on Saturday at a pre-conference meeting. So you're in a privileged position to be some of the first people to actually see what we're proposing. We're proposing a set of global targets that include looking at the reduction in incidence and mortality of both chronic hepatitis B and hepatitis C infection, plus a set of targets covering 6 key interventions. And for hepatitis C, those that are most relevant are looking at increasing the frequency of safe injection practices, promoting harm reduction, and increasing the coverage of hepatitis C treatment. Now, what does this really mean? It means that by 2030, we're looking at an 80% reduction in chronic hepatitis C incidence and universal access to key services. This translates into a reduction in incidence from 2 to 4 million new cases of chronic hepatitis C down to around about 500,000 by 2030. It means 80% of eligible people should be receiving treatment, that there should be universal access to safe injections and harm reduction, and that the number of annual deaths from chronic hepatitis C would be reduced from 700,000 down to around about 260,000. By 2020, we're looking at having treated 3 million people for chronic hepatitis C and a 30% reduction in incidence. Now, in developing this strategy, we actually need to be very practical. If we make these commitments to achieve these targets, then we have to present a strategy that will actually work. And in developing that strategy, there are 5 questions that we need to ask. Firstly, what is the current situation that we face? Secondly, what are the interventions that need to be delivered along the lines that we heard from Tracy? What is the public health approach? What is the public health package? We then need to consider how can we deliver these interventions and services most optimally, and how can we cover the costs? And then finally, if we do what we're doing now, using the technologies that are available now, we will not be able to achieve those targets. So we need innovation, we need new medicines, we need new diagnostics, and we need new service delivery models. So in responding to those questions, we're proposing this framework for a new strategy. The strategy covers 5 strategic directions, and this will set out a plan of action for countries and a plan of action for WHO under each of these strategic directions. Strategic direction talks about the information that is required to inform a focused and high-impact response. Strategic Direction 2 refers to the package of interventions that should be made available within national health benefit packages and delivered by national programs in which recipients do not experience financial hardship. Strategic Direction 3 talks about how we deliver that package of interventions to ensure that we reach the right people in the right places, that we ensure equitable coverage of these services, and that quality is guaranteed. Strategic Direction 4 refers to how we're going to finance the provision of these services and interventions, and Strategic Direction 5 talks about the innovation, the pipeline of new products, approaches that are required for us to achieve these highly ambitious targets. Now, I'll just give you an idea of some of the content of these strategic directions, and please go to the document where it is described in more detail. So in Strategic Direction 1, we talk about what sort of strategic information systems are required to ensure that countries understand their epidemics so they can act most effectively, so that they can develop highly ambitious but very realistic national plans, and that they can advocate so that their plans are fully funded. Under Strategic Direction 2, we're proposing a package of interventions. And when we're talking about a package of interventions, we need to ensure that the full prevention, testing, treatment and care cascade in addressing hepatitis C is covered in that package. We can't just talk about treating hepatitis C, we need to look at prevention as well and diagnosis if we are to achieve the targets. Along that cascade, there are many different interventions and services that need to be delivered, and we need to define what are the highest impact interventions for us to include in the package. WHO is working to develop appropriate guidelines that can clearly outline what are the interventions that need to be delivered. Already in 2014, we produced hepatitis C treatment guidelines, which really provided the range of treatment approaches that could be used in countries without really prioritising or describing how you can best deliver in resource-poor settings. Those guidelines are currently under revision, and we are looking towards releasing updated guidelines towards the end of this year, specifically on hepatitis C. We are also developing guidelines on testing and screening for hepatitis, which should also be released this year. Under Strategic Direction 3, we're looking at what are the health systems and community systems that need to be put in place to ensure that we can deliver sustainable programs. And a key element of this is looking at the whole system of procurement and supply of hepatitis C diagnostics, medicines, and other commodities. And this includes a broad range of interventions and services that I won't go into, but are described in the strategy. We also need to look at how we capacitate the workforce so that we can deliver, particularly at the primary healthcare level, so that we can actually reach the communities that are affected, and particularly the key populations that are marginalised. We need to look at very different models of service delivery and integrating hepatitis services within other services, such as those for drug users and where most infections occur. And community systems that have played a critical role in the HIV response will need to be mobilised to work on hepatitis. And finally, we need to address the critical enabling environments such as laws, policies and legislation to ensure that highly controversial interventions can be implemented. The fourth element is that of financing. We've already heard about the different strategies that can be used for reducing the prices of hepatitis medicines, but we also need to recognise that there are other strategies. Innovative financing, for example, unit aid, in looking at market dynamics to modify market dynamics so that you can actually reduce the prices of hepatitis diagnostics, for example. And also looking at schemes such as health insurance schemes, taxation approaches that can ensure that people can access these services without having to pay out-of-pocket expenses. And then finally, Strategic Direction 5 refers to innovation. And we've already heard about the long pipeline of opportunities with new medicines that are under development. Similarly, we're looking at diagnostics pipelines and also service delivery models and financing models. So that being said, we have got a strategy, a draft strategy, and in that strategy, we aren't asking the question, is it feasible to eliminate hepatitis C and hepatitis B as major public health concerns? We're talking about how we can achieve that. I'd like to acknowledge my colleagues who've helped with this presentation, so thank you.